Hey loves, what's up? Welcome back to my channel, Inspirations by Lati. All right, y'all. So let's jump right into this video. So this video, I'm going to be explaining the difference between MAs and nurses, because a lot of times the two are compared because a lot of the job responsibilities are similar. So I'm going to explain what responsibilities would be the same for the two, and then also what nurses can do that MAs are not allowed to do. So first, speaking of both, and you know what, I'm gonna throw CNA in here too. I'm sorry, you guys, because a lot of people like to compare MAs and CNAs also. And not only that, I know a lot of people on their career path, they might end up being a CNA prior to being an MA, or a CNA prior to being a nurse. I was a CNA before I became a medical assistant. So I just realized I have the wrong necklace on. I have a necklace that matches these earrings. Is exactly like this, the pendant is, and I put the wrong necklace on. I just grabbed the wrong one, but whatever. But anyways, similarities are you're both basically providing care to your patients. Both MAs and nurses, RNs or LPNs, are going to be doing vitals for the patients. They're going to be doing wound care. They're going to be trying to prevent the spread of infection. They're going to be doing blood draws, injections, procedures, assisting with procedures, I should say. You might be prepping the patient for a procedure, or getting the room prepped for a procedure that the provider or doctor is going to do. They're both working under the supervision of a doctor. So they both, MAs and nurses, take orders from the provider or the doctor. Also, you're going to be administering medications. That is going to be the same. So those are a lot of the similarities, like I said, with nurses and MAs. The differences are, so I'll go on into that list next, is MAs. The difference is the medical assistants work under the license of the doctor or the provider, as to where LPNs and nurses, they work under their own license. But the MA, like I said, they work under the license of a provider. They both MAs, like I said, both MAs and nurses work under the orders of the doctor. But as far as like working under your license number, we are only certified. We don't have a license number as medical assistants. RNs and LPNs actually have their own license number. A lot of medical assistants, we are cross-trained to do front staff work, like checking insurances, scheduling, doing phone calls, doing referrals, like referring our patients out to other doctors. All that administrative front staff stuff, MAs are cross-trained to do, where nurses are usually not. They're usually only really the clinical aspect of things, where MAs, we do clinical and we do administrative. So it is good to be able to do both, because you have a better opportunity for employment, because you are knowledgeable and skilled in both areas. Also, like MAs, we do patient education, where we educate our patients on self-care, but we only do basic patient education, whereas nurses, they do more advanced patient education. So basic patient education is going to be teaching your patient how to do a breast exam, how to do a testicular exam, just different things like that is going to be your basic patient education. Things that nurses are allowed to do that medical assistants are not allowed to do, it would be considered out of our scope of practice. Like I said, again, they work under their own license number. They don't work under, they work by they take the orders from the physician, but they have their own license number. They can administer advanced medications. We can administer oral medication. We can administer injections. We can administer topical skin medications to patients, but we don't do advanced medication. And advanced medications would be such as like chemotherapy. Nurses can administer chemotherapy drugs. They can administer blood products, which is going to be like infusions, blood transfusions, different things like that. They start IVs. We are not allowed to start IVs. They can start catheters for patients. We are not allowed to start catheters. And again, they do more of an advanced patient care, where we MAs do a basic patient care, and your advanced patient, I'm sorry, not patient care, but patient education. Your advanced patient education is going to be like your diabetic teachings and things like that. And that's just, you know, a little example. As far as education goes, I think I said this before in one of my other videos. MA school is 10.5 months. The course is actually 9 months, but then you take up 6 weeks, which is a month and a half of doing your externship, where you are actually working hands-on with real patients in a doctor's office. So total, that is 10.5 months before you're technically a certified, you know, considered to have completed the full program. Where nurses, they go to school, LPNs go to school for 2 years, nurses go to school for 4 years, and in those 2 and 4 years is you do prerequisites, a year prerequisite. For LPN, you do a year prereqs, and then you do a year of nursing. And then for RN, you do 2 years of prereqs and 2 years of nursing school. So that is the difference between the education. Obviously, the more schooling, the more money it's going to be. I don't know the exact cost for school for nursing, but I know the medical assistant program is from like 16 to 20,000, somewhere in there. Nursing, if I'm not mistaken, is about, LPN is like 30,000, I want to say. And then our RN is going to be more like 50,000, $40,000 to $50,000. You might want to look those up, because I remember reading that somewhere, but I don't know if I have the numbers exact in my head for LPN and RN, but I'm pretty sure it's right around that ballpark. But just do your own research for your own self when it comes to that, so you know how much you're going to be in debt. You have to take the NCLEX after nursing school, whether it's LPN or RN. You do have to take the NCLEX exam. For medical assistant, you do have to sit for the certification exam, which I know is a 2-hour exam. It's very extensive. It's you do have to be, you're fingerprinted. You have to go through a metal detector. You can't have like anything with you. Like, they check you to make sure you don't have anything, so that way you can cheat. So I know they're trying to prevent people from cheating. Like, you have to have your ID, more than one form of identification, to make sure that you are you. So it's very intense when you sit for the medical assistant certification exam. So I can only imagine for the NCLEX exam, that is probably going to be as intense, you know what I mean? If not more. I don't know how it will be more intense, because they do a thorough check, honey. Make sure who you say you are, and make sure you don't have any notes or anything that you could possibly cheat with. If you have to get up and use the bathroom, you can't just get up and go. You have to literally like raise your hand. The room is totally quiet. They have you in these booths with these headphones, and it's really, like I said, a 2-hour exam, and it's really intense. And you don't have to take the certification exam to work as a medical assistant, but it just validates who you are, and it validates that you know what you're doing and you're knowledgeable as a medical assistant. So I would definitely recommend taking the exam. I have several students that are like, oh, there's no point in taking the exam. I already finished the program. I can get a job. That is true. You don't have to have taken the exam to get a job, but you're worth more money. Automatically, if you're certified, you're going to be paid more money as a medical assistant if you've taken that exam. So keep that in mind. And like I said, the exam is only a few $100s. So it's not pointless, but I just think it's not beneficial for you to not take the exam. It would be more to your benefit for you to take that exam after you finish your medical assistant course. So like I was saying, you know, it's just beneficial for you to go ahead and take the state exam. There's 2 different exams that you can take for medical assistant. There's an RMA, which is registered medical assistant, or you can do the CMA, which is certified medical assistant. It depends on what state you live in, so check with the state and see which one that they would prefer that you take. because one is more recognized just depending on what state you live in. I recommend that you take both. Like I said, they're only a couple $100s a piece. So no matter where you go or wherever you're at, you have both of those titles behind your name. And by not having one or the other is not going to hinder you from employment opportunities or whatever the case may be. So I would recommend having both, okay? The RMA and the CMA. And like I said, if you need some more information on those, I would just do a little more research in the state that you live in. Another thing that I would like to address. So another little thing that I wanted to address also is, the fact that you don't necessarily have to have taken a medical assistant program to work as a medical assistant. So that is true in some regards. What I will say is a random person cannot just walk off the street and say, hey, I want to be a medical assistant and go work in a doctor's office as a medical assistant. There are certain circumstances where doctors are comfortable enough and that will allow them to want to take that risk of having a medical assistant work under their license that has not necessarily completed programming or completed schooling or a course. On the job training medical assistant, as I stated before, that we would have pre-medical students work as medical assistants. So that is something that's totally different. And the reason why I'm bringing this up, because I have watched YouTube videos on this particular topic before, and I always like to go in the comments no matter what video I'm watching. A lot of times I'll go in the comments just to see what people are talking about or what other people's opinions are or what questions they might have or whatever the case may be. So I have experienced this as well, but in the comments on this one particular video, there was a medical assistant going back and forth, an RN, and there was another lady that had, she was a medical assistant, but then she had gone back to school to get her nursing degree as well. So she was on both sides of the field. She worked for a medical assistant for multiple years, but then also continued her education and went back and got her RN. But in the comments, one of the MAs was saying, oh, we do a lot. A lot of our job responsibilities are similar to a medical assistant or a nurse, which is true. It's just that we don't get paid the same. We get paid less, but our skills are pretty extensive and, however, whatever the case may be. And the other lady was kind of the RN lady in the comments was like, oh, you're posing as a nurse. You shouldn't be saying that. You can go to jail. You're blah, 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 blah. So it was just a whole back and forth conversation between these people. And then the nurse was like, well, anybody can walk in off the street and be a medical assistant. You don't even have to go to school to be a medical assistant, and you can get a job as an MA. That is true to a certain degree. That's why I'm bringing this up, because if you guys are watching other videos or getting information from other people on this particular topic, I don't want you to think that you can just not have any type of experience or any training whatsoever in the medical field and go get a job as a medical assistant. Like I said, the doctors, from my experience of being in this field for over a decade, is that if you have some type of medical background, yes, you can be hired as a medical assistant. I mean, we didn't just hire random people. The only people that we would hire that had not completed a program, MA program, they had completed 4 years of college with some type of medical knowledge. No doctor is going to risk their license and have a random person that has no knowledge, even if they are willing to train them, but they're not just going to let anybody practice medicine on their patients. You have to think about that, because as medical assistants, we are responsible of calculating dosages. The doctor tells you what he wants the patient to have. For example, if he says, I need 1 gram of Rocephin, you need to know how to draw up 1 gram of Rocephin, and you need to know how to determine what dosage you are giving the patient. For example, if the doctor says he wants 1 gram of Rocephin and the only thing you have in the cabinet is 250 milligrams, you need to be able to convert that gram over to milligrams as far as to get it to the dose that the doctor has ordered. You got to have that knowledge. You got to know how to give an injection. There's a right and a wrong way to give an injection. You got to know how to do phlebotomy and how to draw blood from these patients. No doctor is going to be willing to risk. Remember, I said that us medical assistants work under the license of the doctor. There's no doctors that's going to be willing to take that risk. I can't see it, and if they are, they're crazy to just hire a random person to be a medical assistant and actually put their care their patient's care in the hands of somebody that's not knowledgeable. So with that being said, there is some truth to that, but there is certain circumstances that is going to allow the doctor, to consider hiring somebody that has not had training. So keep that in mind. And there's always been this kind of tit-tat back and forth thing, with MAs and medical assistants. Sometimes we don't feel like that we're respected as much as we should be, which, I kind of, feel like that or have gotten that. It really doesn't bother me at all, but I've heard people say that before. Just like nurse practitioners feel like that they're not respected on the level as a doctor, because nurse practitioners, they see patients, they can diagnose people, they can order testing, they can prescribe medications, they can do pretty much everything a doctor does. They just don't have that credential, DO or MD behind their name, but they can still do pretty much everything that a doctor can do, but they're not necessarily a doctor. So sometimes your nurse practitioners or physician's assistants feel like they're not as respected as they should be. And I get that because I have witnessed it firsthand for them, working with them, with patients. We've had plenty of patients that are like, I refuse to see a nurse practitioner. I refuse to see a PA because they're not a doctor. I don't want to see them. And it's kind of the same thing with nurses and MAs. Like, I kind of get it because nurses have gone to school much longer than us to earn that title of RN behind their name. I understand that. So I get it to a certain degree. But what I don't like is when they try to minimize our position as medical assistants, because we are just as vital and as important to the medical community as they are. Everybody is a team in the medical office. For example, doctors cannot run an office by themselves. If they didn't have medical assistants or their front staff, administrative front staff office people, or if they didn't have their nurse practitioners backing them up, if they didn't have a billing and coding crew backing them up, the office would not run. It's not only doctors. We know that they are the main core, but you have to have a team in anything you do. So like I said, everybody plays a vital role, and everybody's role is important, and everybody needs to be knowledgeable and skilled, because you're talking about patients' health and patients' lives in your hands. You know what I mean? So it just frustrates me a little bit, because like I said, I understand it on both ends, that RNs, don't like MAs being compared to them because they've, had more education, more schooling. But then again, I don't like when I hear RNs, demeaning what we do because we don't have RN behind our name. Because like I said, quite often I went over the list that what we do and what they do, and the list is not that different, to be quite honest. But like I said, everybody's role is important, and that is the part that frustrates me, when it's kind of like, oh, our role is not significant. And in most of these doctors' offices, a lot of them don't have a nurse. A lot of them have your PAs, your doctors, and medical assistants. A lot of doctors' offices don't hire nurses. They hire MAs to do the position. More hospitals and surgery centers and things like that, nursing homes and things like that hire RNs. But a lot of doctors' offices hire medical assistants because we have a lot of skills, but then they don't have to pay us as much as a nurse either. So just keep that in mind. Everybody's role is important. You know, I just don't, that's just the part that frustrates me about that whole ordeal or situation, you know, that whole topic. As far as pay goes, I'm going to give you an average pay on what nurses make and what MAs make. I'm sorry, let me talk a little bit about CNAs too. CNAs, some schools you can find to do a course in anywhere from I think it's like 3-month courses. For CNAs is a few weeks to 3 months, like 30 to 90 day course for a CNA course to work in a nursing home. You don't work in a doctor's office. You do either home health care or you work in a nursing home. You're bathing people, you're feeding people, you're getting them back and forth to their activities and events, or you're going into their homes and you're doing some light housekeeping, running errands. Sometimes you might have to do vitals. As a CNA, you're doing a lot of total care for patients. You're cleaning them and things like that. So those are the different responsibilities. Earlier in the video, I mentioned the responsibilities of a medical assistant, and those that I just mentioned are the responsibilities of a CNA. And then I also just mentioned the schooling. But as far as pay goes, and like I said, again, this is just an average. Any pay that I mentioned here is an average for these particular careers. So you can make more or you can make less, depending on how much experience you have, depending on where you live, what area you live in is going to determine how much money you're making. But this is just a base average of what people in these fields are making. CNAs make about $11 to about $13 an hour, I want to say, is the average for a CNA. That's average. You can make more, you can make less. For a medical assistant, average is $15 an hour. That is an average. Again, you can make more, you can make less. Some places start you out at $15. After your 90 days, you might get a $2 raise, and then you get an annual 1-year raise every year, depending on, you know, what kind of worker you are. That's going to determine how much of a raise you get, you know, and that's with any job across the board, no matter what career you're in, depending on how dependable you are, what type of worker you are, how professional you are, and that is going to determine, you know, what type of raise you get yearly. Because like I said, I started out at the lower end 13 years ago, and I received a good raise, enough to keep me around for 13 years at the same position. LPN average is going to be $22 an hour. RN average is going to be $30 an hour. Again, experience in the area you live in is going to determine it could be if it's more or less. So just keep that in mind. And then you can always, especially if you're an experienced, if you have years of experience when you first start a job, always make sure you negotiate your pay. You don't have to take the pay that they offer you. You can at least let them know what you think you are worth, because a lot of times they're going to start out with the lowest, and if you take that, then that's just what you're going to be making. Whereas if you negotiate, you know, because when I left my job of 13 years and started working at the hospital, initially what they offered me was not what I was expecting. You know what I mean? I kind of thought I would take a pay cut a little bit just because I'm starting brand new at a brand new job. Even though I have all this great experience and great references from my previous job, they don't know really me and what type of person I am and what type of worker I am. So they're not going to start me off at top dollar. But what they offered me, I was not comfortable with it. So I negotiated and they increased what they were offering me to start off with. So always negotiate. Let's see. So just keep that in mind, you guys. And, you know, if you're thinking about MA school, I don't want to discourage anybody from doing anything. I think that if you have had an option, I think nursing is great, because even if you just start off with the LPN and you want to advance to an RN in the future, you know, medical assistant is good. You know, it just depends on how much schooling you're willing, how much time and dedication you're willing to put into your schooling. If you don't want to go to school for 2+ years, then maybe MA is a good option for you. You know, if you want to start off as an MA and then advance to a RN, you know, at least you're going to be making decent money, and not only that, you're going to be getting the experience that you need. I'm telling you, all the students, the pre-med and pre-nursing and pre-PA students that have worked with us for a year or two, once they get into school with these other students, medical students that have no clue or never worked in an office, they are like 100 steps ahead of them. Like, they are so far ahead of the game. Like, they know all the medicines, they know so much, they have so much more knowledge, and it just makes it that much easier for you to make it through school if you know, use medical assistant as a stepping stone. So just keep that in mind, and I really want you guys to check out my other video. All my other videos, I got several videos, so just, you know, go down, comment, rate, subscribe, and click my channel, and make sure you check out all my other videos. I will be back with another video. Make sure you guys support me, and I'll be back with more and more content, you guys. I'm being consistent. Just, you know, holla at your girl. Bye, loves. Deuces.